I remember attending a meeting in Kansas City that the National Hemophilia Foundation had organized, and one of the plenary topics was this disease was showing up in the hemophilia community. It didn't have a name. We didn't know how or why. And I remember sitting in the audience wondering, is it going to be me? Is it going to be my brother? When I was born in 1960, there was no treatment for hemophilia. We were treated with whole blood or fresh plasma. About 1964, they discovered cryoprecipitate, which was this bit of the blood when frozen that floated to the top, and they discovered it was actually very rich in the component that my blood is missing. It was after that that life really began to change. Soon thereafter, in the 70s, they began to figure out the way to develop concentrates that took that little bit of precipitate and put it into a medicinal product, and then it becomes really freeing. The life expectancy when I was born was in the teenage years to the early 20s. So it really was revolutionary. It was hard to imagine the product that was giving me life was also potentially bringing great death to our community. It was hard for me to believe or to think about going back to the prospect of early death, going back to the prospect of not having the ability to live, travel, work, play, have a social life like others, and to think about going back to my childhood where I spent life in a wheelchair or spent time in bed or in hospital. And so I think there was denial by a lot of folks. There was what I guess would be called a crisis in decision making for just the fear of show me more evidence. I don't want to believe that somebody made a conscious decision that it's okay that this population of people with hemophilia get infected with HIV or this pathogen. I think the regulatory, the oversight, the manufacturing processes that we have today were just not in place, and they didn't function as a system. There was a pretty good confidence that if you had severe hemophilia, that you had been on treatment, that you'd have to be incredibly lucky not to be in that crowd. So I think well before I actually had a formal lab test, I knew. And so the process of coming to grips with HIV being another disease with which I had to live was there. In the early days, when there was really nothing that could be done, there wasn't even a recommendation to get tested. The goal was keep it off the medical records, don't disclose. I was just graduating from law school, really beginning to plan my career. I didn't want it on my medical record. This was pre all of the privacy and the health protections. It was the sort of the late 80s, probably around 1989, when I actually went to a public clinic and did anonymous testing. At that point, then, I knew with certainty, but didn't tell anyone. When we first learned about this, this mysterious thing going on in the blood and potentially in the products that we were using, it was a disparate group of individuals that seemed to be impacted by the same kind of syndrome. And at the time, it was known as the 4-H's. For me, 4-H growing up in Kansas was a group I could join in high school where you participate in activities for the county fair and all this good stuff. But the association of the 4-H's for us was not a good one. And so the 4-H's, as I remember them, were hemophiliacs, my population, homosexuals, Haitians, and heroin addicts or IV drug users. And as you sort of scratch your head, what's the commonality among us? It was difficult. And then, thinking back to the 80s, there was a lot of stigma associated with some of those populations. We were really instructed by our healthcare providers, by our treatment centers, be very careful about who you disclose and tell about your hemophilia, just the impact on sort of employment and life. This was completely counter to everything else that we had been told. Most people that live with chronic diseases are told, own your disease, sort of learn it, cope with it, tell people, be open to talk about it. And so my life before that was fairly open. All of my friends and family and everybody knew that I had hemophilia. And when this came, I really shut down. I just didn't talk about it. When I would have a bleed and I would have an injury, I might be walking with a cane or having, I'd make up some excuse. I didn't want to say I have hemophilia. Based on what was happening in the wider news world, I was just too afraid of it slipping out. The only people I told were my mom and dad. And I specifically asked them not to tell my brother or anybody else. And I think that was hard on a lot of people, not having a support network. I know it was hard on my parents. It was probably harder on me than I realized. The cost of treatment with hemophilia, beyond just the economic and the family burdens and the cost, the actual cost of the medication really is enormous. My current medication bills exceed $500,000 a year just for product alone, and I do an IV infusion 3 times a week. For those that have either less severe conditions, it can be less, but the typical numbers would easily average out to in excess of $300,000 a year for a patient. As I think back about what happened and how we got to where we are today with hemophilia and the federal advocacy to support the passage of the Ryan White Act, the Ricky Ray Relief Program, we probably were beneficial to the cause in that we were perceived, and although I don't like the word, as the innocent victims. We created, for many, an air of legitimacy in terms of why the government should and could care and could spend money. We have served such an important role as guardians of the nation's blood supply. We are the proverbial canary in the mine shaft. When something goes wrong, it tends to happen first to us. And so we became a sentinel for a crisis that was spreading across the country. So I think we helped highlight this and other bloodborne pathogens that have been since. Had we not been there, it might have taken a little bit longer, and we might not have progressed as fast as we did.